Bariatric surgery is more strongly recommended in obese patients with type 2 diabetes mellitus when diabetes is inadequately controlled despite optimal lifestyle and pharmacologic therapy, including insulin. With the increase of bariatric surgery procedures across the world, it is important to better understand the outcome of the disease, especially in surgical candidates experiencing advanced stages of T2D. However, data on the midterm effect of Roux-en-Y gastric bypass and sleeve gastrectomy on this group of patients is scant. We'll review a study that is conducted at Hospital Clinic in Barcelona to evaluate the extent and duration of the hypoglycemic effect of bariatric surgery in patients with type 2 diabetes mellitus treated with insulin. A prospective observational study, 4.9 plus or minus 1.9 years, was conducted on the results of TDM2, the changes in hemoglobin A1C, HbA1c, and the therapy of diabetes in individuals with DM2 treated with insulin who underwent Roux-en-Y gastric bypass, 24 patients, of sleeve gastrectomy, 50 patients. Study participants were selected from among the 344 patients with T2DM who underwent bariatric surgery at Hospital Clinic between January 2005 and December 2013. Selection criteria for the study included insulin therapy before surgery and post-surgical follow-up of at least 24 months at the time of this analysis. T2DM remission was defined as HbA1c lower than 6.5% and FPG lower than 126 mg per deciliter without hypoglycemic medication. T2DM relapse criteria for T2DM according to ADA after T2DM remission attained after bariatric surgery. Results. Overall, remission was observed initially in 20 out of 74 patients, 27%. However, throughout follow-up, T2D relapse was observed in 13 out of 20 participants, 65%, resulting in a final proportion of 90.5% of the cohort presenting with T2DM at the last follow-up visit, 67 out of 74 patients. Sustained remission was associated with younger age, lower HbA1c, a tendency toward shorter duration of T2DM, and NBB insulin therapy compared with patients with non-remitting diabetes, but not with differences in the percentage of EWL over the observation period. Initial reduction of HbA1c and high rates of insulin cessation were observed. HbA1c nadir 5.9% plus or minus 0.9%, insulin cessation rate 66.2%. However, these were followed by progressive deterioration of HbA1c. HbA1c at last follow-up 7.4% plus or minus 1.3%, p smaller than 0.001, and need for insulin therapy reintroduction. Rate of insulin cessation at last follow-up visit 54%, p equal 0.04. Results. Roux-en-Y gastric bypass versus sleeve gastrectomy. In multivariate analysis, larger maximum percent excess weight loss and non-basal bolus insulin therapy were identified as significant predictors of diabetes remission, insulin cessation, and durability of HbA1c smaller than 7%. Comparison of T2DM remission rates at 1, 2, and 3 years demonstrated a tendency towards higher remission rates after Roux-en-Y gastric bypass, even though comparison was significant only at 3 years. Likewise, Roux-en-Y gastric bypass patients presented with lower HbA1c levels at 24, 36, and 48 months after surgery, despite the percentage of excess of weight loss not being significantly different between surgical groups. Finally, the Kaplan-Meier analysis demonstrated that the median time free of T2D was longer for Roux-en-Y gastric bypass patients than for sleeve gastrectomy patients, 47.8 plus or minus 14.6 and 28.8 plus or minus 4.6 months, respectively, albeit no statistically significant differences were found, p equals 0.167. Conclusion. In insulin-treated patients with T2DM, bariatric surgery is associated with a low likelihood of midterm diabetes remission. Overall, in this group of patients, the marked initial improvement in glycemic control and insulin independence are of limited durability. In addition, in this group of patients, the need for prandial insulin and lower post-surgical weight loss may hamper the beneficial effects of bariatric surgery and glycemic control.